I would have no hesitation telling people to come and work in a place like this. You're not isolated. It's only 3 hours from Melbourne. Work-life balance is excellent. Hamilton's a very pleasant, genteel town. It's a good place to live. And I haven't regretted a minute of coming here. I was attracted to Hamilton because the reputation of Hamilton was excellent. The reason Hamilton has been able to maintain really good quality doctors is we've had a critical mass of senior medical staff who are interested in quality, interested in innovation, interested in keeping up to date and cooperate with each other. This commitment to quality, maintaining standards and having motivated doctors who want to teach, want to get the college to rotate registrars up here to do their training. We've got junior staff here, so we're a teaching hospital. And that attracts quality. I mean, quality attracts qualities. And equally as importantly, we have a very good community that supports the hospital.
I'm a GP who's worked in Hamilton for pretty close to 30 years now. One of the things that has developed over the last 10 years in this practice is actually the ability to take medical students on a long-term basis. As well as that, over many years, going on over 30 years, we've had intermittently GP trainees who have worked in our practice. It's very common in hospitals or populations of this size that GPs will be responsible both for the outpatient work in their own practice as well as inpatient responsibilities. And in many ways that's one of the advantages of rural or regional practices, that you have the opportunity to practice to the limits of your skills rather than being confined to a more narrow mode of practice.
My husband and I came down here for a very short term, for a year, to take up a job as a graduate midwife 10 years ago, and we loved it, so we stayed. The lovely thing about working in a smaller unit rather than a tertiary centre in the city is that you know many of the women coming in, so you have a personal attachment to them, not just there as a client. Great place to work, great place to live.
There's excellent community support for the health service. We have a very high level of donations, which enables us to make sure that our equipment is up to date. You also have, there's sort of a critical mass in terms of the professional support for health professionals, and we've been able to achieve that. And then you've got the broader community in terms of things like education, just the culture of the community that is, I think, is also attractive to people who come to work here.